All right. Well, it looks like we're still having a little bit of technical difficulties on the commissioner's end, but that's okay. I'll go ahead and I'll get us kicked off and started, and we'll continue to work on that so that he can join us when he's able to have audio and perhaps visuals. So first of all, I just want to welcome you all to our call today. Thank you so much for taking time out of your schedule to meet with us. We went ahead and scheduled it for an hour and a half. I don't know that it'll take that long. So hopefully we'll be able to move through this pretty quickly. To introduce myself, I am Corinne Gould, and I serve as Assistant Commissioner for Public Affairs for the Tennessee Department of Agriculture. And our goal for the call today is to go over some resources and toolkit items that we have available for you now as ag operators who employ ag workers. And these ag workers can be seasonal, they can be yearly, they can be folks that just come to your farm from time to time. I think we're all here for the same goal. We want to slow the spread of COVID-19 as much as we possibly can. And so we want to work together to be able to do that. I hope you'll be able to find some information here that will be helpful to you. Commissioner, do we have your audio yet? All right, in that case, did I hear you, Commissioner? Okay, is our Deputy Commissioner Tom Womack on? All right, well.
Can you hear me, Corinne?
Yes, Tom, thank you. Do you mind going ahead and giving us a brief welcome as well?
Yes, first of all, I want to thank our partners and friends at the Tennessee Department of Health. Of course, they've had their plate full over the last few months and have been in the eye of the storm of responding, and they've done an admirable job. Tennessee, I think, has been recognized for their response to COVID. And early on, when we had concerns about the food supply chain, production and processing facilities, they were very quick to respond and to work with us to be able to help address some of the workforce issues that we were seeing. And we couldn't have done it without their help.
Hello?
Yeah, did I hear the commissioner? I'll turn it over to him.
Yeah, can you hear me now?
Yes.
Oh, good, great. We've been working frantically for the past 15, 20 minutes, and we haven't been able to get the camera working. But yeah, Tom said it better than I could have said it. So this has been a partnership effort. We've been working with the Department of Health, the Unified Command, the Governor's Office, because we know there's some challenges on the farm with farm workers. And before we jump into that, I would also like to thank all the farm operators that are on this call for being part of the critical infrastructure. And you are, and you're feeding the world in Tennessee. And from the start of this pandemic, you've been handling things and been a leader in the food supply. And so we really do appreciate that. But yeah, we are unveiling today a toolkit that Corey and her team and working with the health department and others have come up with a toolkit to slow the spread of COVID-19 on farms. And you guys have unique challenges on the farms due to the proximity of some of the workers and the living conditions or the living situation rather, and the way that they're transported, so on and so forth. So without further ado, we've got some good information for you today, and I'll turn it back to Tom if he has further comments, or to Corey.
No, Commissioner. If nothing else, this pandemic shows how important our food supply chain or our fiber supply chain has been. And we know that a lot of Tennessee farmers are doing the right things, be able to protect their workforce, but also to protect their business. And we want to learn more about that today. Corey?
Thank you, Commissioner. Just a quick note, we are actually recording this WebEx, so I know that everyone's time is very valuable and precious. So if for some reason you do need to drop off a little bit early, we will be making this link to this recording available on our website later today as soon as possible. But I'll go ahead and I've got the agenda pulled up there. You can see what we're going to cover this afternoon. At this time, I'll go ahead and turn it over to Katie Garman. She's the Director of Enteric Disease Surveillance and Outbreak Investigations with the Tennessee Department of Health. And Katie can give us an overview. She has been instrumental in helping us fill out that toolkit with some resources that are going to be available for you. So Katie, if you want to take over your screen and share it.
Yeah, I think I need to have someone make me a presenter before I can do that.
Okay, Tina, are you able to do that?
There we go. Awesome. All right. Party set. All right. Good afternoon, everyone. Thank you so much for allowing me to talk today. My name is Katie Garman. I'm with the Tennessee Department of Health. And normally I work with our foodborne surveillance and outbreak investigation section. So we do have a very close relationship with AG as we investigate foodborne outbreaks. And it's been great to work with AG in this COVID response as well. So I'm going to take the next 10 or 15 minutes just to provide you all with an update on COVID-19 in Tennessee and just go through how it's impacted our rural areas and our agricultural community. So first, I'm going to start with a COVID-19 overview. Just for some basic information, COVID or novel coronavirus or COVID-19 is a respiratory illness caused by a virus that can spread from person to person. And this is a new coronavirus. There's other coronaviruses out there that cause the common cold, but this is a new one that has obviously impacted our state and our nation. There currently is not a vaccine, as probably many of you know, although there are some treatments being studied. The current care is supportive care. And really the best way for us to protect ourselves and our families and our workers are to avoid being exposed to the virus that causes COVID-19. So just a little bit of information about symptoms. So our symptoms for COVID-19 our big symptoms are cough, fever, shortness of breath, fatigue, a muscle or body ache, headache, loss of smell or taste. And then some folks have sore throat or congestion and runny nose. And then some even experience gastrointestinal issues such as diarrhea or nausea and vomiting. You know, symptoms can range from being very, very mild. I know I've talked with some people who just thought it was allergies, but when they had their COVID test, it came back positive. But then there are some that have a very severe illness and require hospitalization. Now, as I mentioned before, the spread of COVID-19 is spread through respiratory droplets when an infected person coughs, sneezes, or talks. It's primarily spread person to person, so through that close contact of being 6 feet next to someone else. It may also be spread through surfaces with virus on it. However, I think people are more concerned with that person-to-person spread and being close to one another. And it's important to note, and we've learned a lot about this in the last few months, is that people even without symptoms can spread this virus. And then the folks that are at risk, really anyone is at risk of getting COVID-19. However, we do have groups of folks that are at higher risk, our older population, our population in congregate settings such as nursing homes, and also those that have underlying medical conditions such as asthma or other conditions that may affect their health overall. And then our population that has immunocompromising conditions, such as HIV or they're on chemotherapy. All right, so right now I just want to go over some COVID-19 terminology. Sometimes epidemiologists and public health professionals, we speak our own language, so I just want to make sure we're all on the same page. So when I talk about a case is a person who tests positive for COVID-19. And then a contact is a person who's exposed or within that 6 feet for 10 minutes. And they're exposed to that person who tested positive, so to that case. And then we have, different terminologies when it comes to isolation and quarantine. So when we talk about isolation, this is for our cases, so people who tested positive for COVID-19. And what isolation does is it prevents cases from transmitting the virus to others. And it should include isolation from household contacts where possible. The CDC has put a lot, the Centers for Disease Control, the CDC has put a lot of information out here on how COVID-19 patients really need to be mindful of those that they live with to avoid the spread of the virus to the people in their household. Now, when we talk about quarantine, that's when we focus on our contacts, so those folks that have been around the cases or exposed to the cases. And that allows for monitoring of symptoms. So we want to make sure we, keep them at home and not going tons of places in case they do develop symptoms, or they also might be an asymptomatic shedder. So we don't want to, have them, unknowingly spreading this virus to others. Okay, and my last two terms here, we have what's called an infectious period. So it's the amount of time a case, so someone who tested positive for COVID-19 can transmit the virus. So it's estimated to be from 2 days before symptoms to 10 days after the symptoms begin. And then with asymptomatic cases, it's more difficult to estimate. However, we're currently using a 10-day time period there. An incubation period is the amount of time it takes for an infectious person to show symptoms or to be able to transmit that virus. So it's about a median of 4 to 5 days, but there is quite a range on that from 2 to 14 days. Okay, so let's look at COVID-19 in Tennessee. So this data is as of yesterday, and this is published on the Tennessee Department of Health website every day after 2 p.m. And as you can see, looking at the map of our state above, you can see that Shelby County, where Memphis is, and Davidson County, where Nashville is, are definitely leading the pack with the number of reported cases. And this is as of, when we first had our very first case in Williamson County in March of 2020. And you can see there's other counties within, we call this the Mid-Cumberland area, the counties that surround Nashville, such as Rutherford, have quite a few cases, and then you can see other metropolitan areas and their surrounding counties have many cases as well. This is Hamilton County, where Chattanooga is, and Knox County, where Knoxville is. And then what we have on the bottom here, this is what epidemiologists call an epidemic curve. So here we have the date of when people, their illness onset date. So the date they first started either having symptoms, or if they didn't have symptoms, the date they got their test. And as you can see, we continue to have increases of cases as we unfortunately go through the summer months. All right, I'm going to talk now a little bit about the impact on our rural communities and show you all how you can access this data to keep your finger on the pulse of COVID in Tennessee. All right, so let me just orient you to this picture right here. So when you're looking at this on your left side, the areas in blue, this is our 21-day testing rate. So this shows the amount of testing that's going on in Tennessee, or in West Tennessee. And if you look at this as like a donut, the whole of the donut, this is Madison County. And so our counties around in the southern or south of Madison County, we're seeing a lot of testing there and also above. Now, if you look over to your right, again, it's the same picture. It's just we're looking at a 21-day case rate. So of the people who are testing positive for COVID. So you can see counties like Haywood, Fayette, and Harding you're seeing those darker areas, and that, as the darker we go, the more cases that we see. I'm going to also show you this for the Mid-Cumberland region. So again, just to orient yourself to this. So if we look at this as a donut, the whole is Davidson County. The blue looks at our testing rate, and then the red looks at our positivity rate or our case rate. And again, the darker the red, the higher the case rate. So you can see here that it's, Rutherford County it's got quite in some of their zip codes has a high case rate, as well as some of Wilson. And then finally, we have East Tennessee. Again, the whole of the donut is Knox County, and blue is testing, red is case rate. And again, you can see here through this kind of southeast or area or southeast of Knox County, you know, Blount, Sevier, Cott County, we're seeing a high case rate in that area. So this just shows 3 of our 13 health regions, and I'm just going to quickly go through how you can find this data on your own. So if you go to tn.gov/health, and you want to click on this yellow bar here to get to all of our COVID resources from the Tennessee Department of Health. And when you do that, you want to scroll down about halfway through the page, and you're going to get to this section where you're going to click here for complete data report, including county level information. So when you click on that, there's a whole slew of data you can look at. But if you want to specifically look at the maps I just showed you, you would click on maps. And then you're going to go to this third tab that's titled Recent Trends by Zip Code. And you can just simply select your region. So if, for example, if you have a farm that's in the plateau, if you scroll all the way down here, I'm sorry, this is a picture, so I can't do that. You'll see one of our regions is Upper Cumberland. That takes care of our plateau area. If your farm is in the upper northeast region of our state, you would simply click on Northeast. And then you can generate maps like I just showed for you. And again, it looks at a 21-day window. All right, I'm going to talk a little bit now about the different clusters that the health department has investigated that have been associated with farms. So again, another term, cluster. So what we define a cluster is 2 or more confirmed cases, so those that have tested positive for COVID, among staff members of the same farm within 2 incubation periods. So again, incubation period is that time from when you get the germ in your body to when you get sick. And the average is usually 2 to 14 days. So double that is how we come up with this 28 days. So since May of 2020, Tennessee has reported 8 farm clusters. They have been in Middle and East Tennessee. And of these 8 clusters, there have been nearly 350 cases, and fortunately no deaths. So that's definitely good to report. And I know later on in the session, we are going to talk to a farmer later who will be able to talk about her experience with this. All right, and then lastly, I just want to make a note about how farming and agriculture is part of our critical infrastructure. So there are about nearly 20 job categories that fall into this critical infrastructure sector. And those who are working in farming and agriculture are definitely part of that sector. And so with that, so when we have someone who has been exposed to maybe someone with COVID but do not have symptoms, the Tennessee Department of Health does allow them to continue working following some guidelines that we have listed here below. Now, this does not include people who test positive, and they should still remain in quarantine from all other activities or gatherings. So if you have a group of people who are contacts, they can kind of stay together in their own little cohort, but try not to get them involved in other settings or gatherings. So in this process, they would need to be pre-screened. So making sure they're not feeling sick or having a fever. We want to make sure that they are monitored regularly. So you continue to monitor for those symptoms of COVID. We ask that they do wear a mask, social distance when they can, and that their workspace is disinfected. And there is more information about this on the Tennessee Department of Health website, and I have the source listed right here. And these slides will be made available after this call. All right, so that concludes my presentation. Thank you again, and I don't know if we're going to take questions now, Corinne, or if we're going to do it at the end of the session.
We'll go ahead and take questions at the end. So if anybody has any questions,
perfect.
Please go ahead and hang on to them for now. All right. Well, thank you so much, Katie. We appreciate that presentation. That gives us a really much perspective obviously on the overview of how COVID-19 is affecting Tennessee, but also more specifically, how it is affecting our farms and our rural communities, which obviously touches all of us in a variety of ways. I'm going to go ahead and take it over again here now and share my screen. We'll pull back up our PowerPoint here. Real value in the hearing from a farmer who's been through this and has experienced it. And so I'd like to welcome and introduce Renee Jones-Rogers. She's joining us today from Jones and Church Farms. And Renee, if you would please go ahead and introduce yourself, tell us a little bit about your operation, and then we'll get into you and your farm's experience in managing COVID-19.
All right, great. Can you hear me?
Yes, ma'am.
All right. So first I want to say thank you for allowing me to participate in this, and thank you to all of the farmers that are on the call that are experiencing and working through COVID. I know your challenges, and I guess my takeaway message from all of this is that we've just got to all work together to get through this, and our workers are wanting to work together with us, and so we're gonna all be okay. We're still farming, and we're gonna all be okay at the end of the day. But so our experience, we have about 180 workers on the farm right now, and we started out with 80. So in April, when we first started getting folks in, we looked at our operation. Our farm manager Greg Church and Mike Church, and then our food safety director Lacey Church for the field. We all got together and we said, we've got to be prepared for this, because this is coming to the farm and we know it's coming. So we started updating our policies, our sanitation policies, and our procedures. We started looking at the transportation and the residents, the dormitories, and what we needed to do to be ready for them to arrive on the farm. So we increased all our sanitation, and then we also started thinking about temperature checks, and at that time getting thermometers and gloves was that was a challenge all on its own. But anyhow, we finally got enough thermometers to have available to make sure we started temperature screening. We also kind of thought about things that were off the farm, as far as grocery shopping and laundry facilities. At the time in Unicoi County, we had 0 cases. So we weren't really concerned about the grocery shopping, but we were a little concerned about the laundry facilities. So we were proactive, and in an abundance of caution, spoke with a friend of ours that had the laundromat here in the county, and we actually kind of rented that out and let our workers go in for a couple of hours. I think they let us come in 2 or 3 times a week, and we would pay to have that cleaned before they came in, and then have that cleaned after they came in. We did that the first 2 weeks they were in the country, and that kind of got through that quarantine period. And then, as I was saying, we were at that time 0 in our county, so we kind of just continued to temperature check, and then came along community spread in the county, and we started getting some more. So the health department contacted us, and I can't say enough about our local health department in working through with this, because we engaged them, and they did our testing. We tested 130 folks on the farm, and then we actually had 10 cases, and they were isolated to 1 crew. So we were able to quarantine that crew together, isolate that crew together, and isolated the contacts in a separate camp, because we didn't have everybody here at that time. So that worked okay. And then along came the larger crew, the harvest crew that came in. And that's where we really started seeing the challenges then, because at that point our housing started being maxed out. We didn't have as much room to isolate, as much room to deal with things. And then so that's where we're at now. We're also in the packing house. In the packing house, we started we're wearing masks, we're temperature checking, we're screening. If you can't be 6 feet away from each other, you have to be wear a mask. They're wearing masks in transportation. Again, we increase our sanitation in our packing house to where we have someone that literally goes through and wipes all the drinks machines, the doorknobs, the faucets in the bathroom, sanitizes everything every 2 hours. We're sanitizing tow motor steering wheels, forklift, forklift operator handles, everything that people are touching in between the 2 hours. We're sanitizing those every 2 hours just to try to eliminate any spread of COVID that we can. We're also looking at grocery shopping now, where we do have two more positive cases. We have those in isolation and are having groceries delivered in to the guys. So that's kind of where we're at. Again, it's just I was telling someone today, you never know. Every day is a different day. It's ever evolving, and we just have to remain flexible. And our main goal is to keep our employees safe, our families safe, and provide a food source, a safe food source to our consumers. So that's where we're at. I know everybody on this call are dealing with the same challenges and working through them through their operations, and I applaud you for doing that. No one has all the answers. We don't pretend to be, but we just got to find out what works for your farm and get through this.
Well, thank you so much, Renee. And Commissioner, obviously jump in if you have anything that you want to add to this. But Renee, I was going to ask, what has been, just generally speaking, the response from your employees as you have put these new procedures?
For the majority of it, they've all been very appreciative. Actually, when I handed out masks, our health department, again, can't say enough great things about them and helping us work through the guidance, but they actually gave us some of the masks. And so we gave each of our employees 2 of the masks. And when we gave them to them, they were very appreciative. They said, thank you. They're concerned. They're worried. They want to be here to work, but at the same time, they want to remain safe. I guess the hardest challenge for them was where we have the same workers that come back every year. Their biggest challenge was telling them that we're going to have to move housing around because they were kind of used to their spot in their housing. And so when we had to start reconfiguring that a little bit in order to, have the quarantine space, that was a little difficult. And they did have a little bit of challenge with that, but, they understand it's for the greater good. And their hope is that at some point this season, they'll get back in their place.
Excellent. Well, thank you.
I might mention one other thing that we did is that we there is our exterminator has some kind of a compound out there that they can treat the camps for COVIDs. It's a compound they spray. You have to stay out of it for 2 hours, and it's supposed to control for 2 weeks. And we've had great success with that as well.
You've already mentioned this, but was the isolation the biggest challenge of the plan?
Yes, sir. It definitely was.
And how did you do that? So that was, I know how we do it in horses, but I assume it's similar. So you have isolation area and then they stay there?
Yeah, so we have rooms that hold about 10 people. So we made one room, the quarantine room, and kind of just everybody that tested positive or they stayed in that room.
And then how difficult was coordinating the testing, and how often do you do that?
For us, it was the health. You probably want to ask the health department that question. They just did fabulous for us. They coordinated that. They came here on site and did it. We've done it twice now, and so it's been 4 weeks apart.
Okay, thank you.
And actually, that's takes me to the next topic. I was going to put Katie Garman back on the spot a little bit. Katie, are you able to talk a little bit about what people should do if they would like to reach out to their local health departments to make arrangements for testing?
Yeah, hi. Yeah, so it's always the best to contact your local health department to start those conversations. I know just from conversations I've had with some of our other health regions, there is some testing going on in the southeastern region right now. So yeah, your best way is to talk to your local health department officials, and they will be able to, especially you definitely want to contact them if you suspect you have any ongoing transmission on your farm. That's when you definitely want to pick up the phone and call them. Or, you know, if you don't feel like you have transmission right now, but you want to prepare, you definitely, you know, can give them a call and start those conversations on, you know, what they can do, what, you know, services they can provide.
Thank you so much, Katie. And we just want to emphasize the point. This is not an effort to get anybody or you know, to track anybody down or get anybody into trouble. This isn't what this is about. Obviously, right. We know that the quicker that we can identify cases, particularly with the challenges with asymptomatic individuals, the quicker that we can identify those cases and get those folks isolated or quarantined as appropriate, then we know that we can stop that spread in its tracks. So this is really a partnership, you know, Department of Health, Department of Agriculture, and particularly you farmers that are the front lines for all of this. So we really want to emphasize that partnership piece to it. Are there any other, Commissioner, do you have any other comments to add on Renee's presentation?
I don't think so. I mean, an excellent presentation, and it's really valuable to hear how you actually execute a plan on a farm and what you've been through. That's very interesting.
Well, yes, and thank you so much, Renee. I know that you had another conflict that you were going to have to jump off the call for, but we definitely appreciate you and for providing that very important perspective. So thank you. Again, if you have any questions, you are welcome to put them in the chat as well. If you're able to access the chat function, we'll be circulating through those too, and we'll also take questions at the end. But I'd like to go ahead and share with you now some of the toolkit and resources that you're going to be able to use in real time on your farms to be able to help you navigate to some of this. So I'm actually kind of doing a little bit of a live show and tell here. This is our main website. This is tn.gov/agriculture. You can obviously, it looks a little bit different from normal. It's, you know, all COVID all the time, as Commissioner says up here at the top. But when you scroll down, you'll see we've got our main COVID-19 messaging, and then I'm going to click us directly to our COVID-19 resources page. And so this is the key page that you're really going to want to bookmark and hang on to. We are updating this page frequently, and as the situation has evolved and changed. And hang on to this thought, because I'm going to come right back to this in just a second. I want to show you a couple other things on here. So early on in this pandemic and throughout the first stages of it, as a department, we started working with our partners in health and our partners in the ag industry to develop guidance for different sectors of the ag industry. So if you scroll down partway down the page here, you're going to see this ag industry guidance. And that very top one, guidance for farms and forestry businesses, that's just a good overview of the sanitation steps that you should be taking per CDC guidelines, how frequently you should be sanitizing, what you should be sanitizing with, different guidelines for social distancing and when it's appropriate to wear a mask. But we have all of those. You can see we spent a lot of time putting these together, and hopefully you'll find some information there that will be useful for your particular operation. Obviously, it's not a one-size-fits-all. We tried to speak pretty broadly, but we also tried to obviously address your particular needs. So then I'm going to scroll back up. This is a pretty extensive page. I encourage you to take a look at it and see all that we have to offer here. All of this is related to COVID-19, but I'm going to come back up here. This is the toolkit. This is our brand new section that we just built out within the last couple of days. And so this is something that's going to hopefully have some tools that you can use, like I said, on your farms and in your operations. The main place that we're going to start is the COVID-19 prevention monitoring and management for agricultural settings. We have this available in English and Spanish, and this was Katie's project. She was instrumental in putting this together. So it's kind of a big booklet. but there's a lot of really good information here. So I'm just going to kind of scroll through this quickly. I mean, it goes over a lot of what Katie has already discussed about the different terminology, different general ways for prevention and control, and also for training for employees to be able to avoid spreading COVID-19. But then it also gets down into the specifics of how to monitor your employees, what to do if you have an employee who gets sick, the different procedures for contact tracing. You can see that it is really just a broad swath. This should be your go-to item to be able to determine your COVID-19 plan. And I'm skipping through this pretty quickly. I encourage you to go back and take a look at it. But the important takeaway here is that we also have a lot of really important resources and links, stuff like what to expect after you're diagnosed or possibly exposed. We have also, the health has made these available in Spanish language as well. And actually, a lot of those are included down here at the bottom of this document. What to expect after being diagnosed with COVID-19, and then we've got it, health has listed it in Spanish as well. So for your non-English speaking employees, this is going to be very helpful for them. Please also know that health provides a lot of these resources in other languages too. And in particular, if you have a language that your employees are speaking that is not addressed through these resources, please let us know. Let us know at the Department of Health, let us know at the Department of Agriculture, because we have ways to work with translation services to get all of this information actually translated. So that's a quick look at the Ag book. Like I said, if you don't take anything else away from that, I strongly encourage you to, or take anything away from this meeting, I strongly encourage you to review that. And then we just have a variety of other items here. You know, we get a lot of questions about what are employee rights under the Families First Coronavirus Response Act. We have a link to that. The health department has also put together an entire web page just in Spanish related to COVID-19, and they continue to improve this and build this out. This just launched relatively recently. So there's a lot of information here and a lot of resources for your Spanish-speaking employees. And then we've got some stuff here as well. We've got flyers that you can actually print out at your facility and post however you see fit. I have these in English and in Spanish as well. We'll see if one loads here. You know, this is just kind of a checklist, one pager for you for some things to keep in mind. And then we also have messaging geared specifically for workers. So that was for the ag operators. This is for the ag workers. So you can put this, and we have it in English and Spanish, anywhere that your employees may congregate or may see on a daily basis, like around sinks or restrooms. So we have those available for you. You can just print those off. You can download them, print them off, and have them to keep. Now, we also did this same information in a poster standpoint. So it's the same information, but it's just in an 11 by 17 format. So again, you can print this and have a larger version of it if that is helpful to you. Or we have actually just ordered a bunch of these posters. And so the Department of Agriculture will have these posters laminated available to you. So if you're interested in receiving those posters, please let me know, because I'll be glad to get some posters out to you, get them delivered, or drop them in the mail to you. One of our other big pushes that we've worked on in the last few weeks, and it was a little more challenging, I think, than any of us expected, because obviously we wanted to make sure we were sharing accurate information, but also make sure that we were sharing it in a way that was going to speak to our Spanish-speaking audience. We produced several Spanish language videos. And I'm not going to play them, but this just gives you a quick idea. This very first one actually explains, oh, and it's not going to show here unless I'm playing it. It actually shows and demonstrates the testing process. I know that we've heard specifically from the Spanish-speaking and migrant communities that there was a lot of concern and maybe misunderstanding and perhaps even a little bit of mistrust about what the testing process is like. And I know that if any of you have had the test, especially kind of the early, really, deep swab test versions, not particularly pleasant, right? However, we wanted to go ahead and demonstrate and explain the different options for testing so that people weren't concerned about that, that kind of knew what to expect as they were going to get tested. And then we have additional videos that we also produced, just the basics of what is COVID-19, all in Spanish language. And one of our Department of Agriculture staff, who is fluent, actually narrated that video for us. And then we also do additionally, how does COVID-19 spread and how to protect yourself from COVID-19. And the thing about those 3 videos is that we at the Department of Agriculture actually put those videos together geared specifically for ag workers. So we very specifically wanted to target that audience so that it wasn't just a generic, well, how does COVID-19 spread? We applied it to agricultural settings and situations. So this has been a big push for us. We're going to continue to build out this toolkit as we get our hands on more information that's going to appeal to you and be valuable to you as ag operators. I encourage you to navigate to this website, use this as a resource for you, share it with your employees. And like I said, we've got stuff here that you can just directly print and download. And also, if anyone is interested in getting any of those posters, by all means, please reach out to me. So that's just a quick overview of our posters, or excuse me, of our toolkits and our resources. Commissioner, I am going to toss it back over to you if you'd like to open the floor for any questions and any parting comments as well.
Okay, let's open it up then for questions for any of the panelists, if you will.
It looks like we do. I don't know, Tina, if you're able to see if we have any on the chat. If anybody has any questions, you can also add that to the chat as well.
I've just got the one that is case rate per 100,000 population in county or per 100,000 tested.
What's the definition of case rate? Can somebody go over that again? That's one of the questions on chat.
Hi, this is Katie. So it is the number of positive tests per 100,000 population.
And Katie, are you able to address in just general terms, obviously we see the big numbers associated with our urban areas, which I know that would be expected no matter what is going on. But are the situations that we're seeing in our rural areas, are those of particular concern, or do we just see those as general par for the course, what was expected?
Yeah, I mean, I don't know if there's a real good black and white answer to that. I mean, there are definitely areas where, we've seen, some hot spots, and, when we monitor the counties that we see over 30 cases reported each day. So unfortunately, I don't have a list of those counties right now, but there are a lot of rural counties. I know Rutherford continues to be on that because that's where I live. But we do see kind of a fair amount of our rural counties kind of on that watch list, if you will. And I think it's attributed to a lot of different situations. And a lot of it is due to community spread, and yeah, we do have clusters of outbreaks going on, and various situations. On our website, you can keep track of all of the clusters associated with long-term care facilities. So that obviously is something we watch very closely and make that public, I believe, on a weekly basis.
Katie, do we know how many ag workers have been tested in total?
I do not have that information in front of me.
That's okay.
Yeah.
Have there been any farms that have had to suspend operations for a time?
I am not 100% sure. Yeah. I know different.
Yeah, I haven't heard of any. I haven't heard of any. I know a few of the meat processors did early on, but that's the point of this. We want to be as proactive as we can and hit this straight on and try to use all the tools that you're provided with, because we're still right in the middle of this. Seems to me like, I mean, it's not. It doesn't look like it's going to let up. So we got to double down and focus on this and try to keep it, because these farms and operators are so critical to the supply chain. And we can't allow, we want to try to prevent these cluster outbreaks among the farms if we possibly can. So all these departments and all state governments here to help you. And if you've got questions or or need assistance, that's what we want to try to provide.
Gotcha. Yeah. And as far as any farm related shutdowns, I have not heard of any. So you're right. And you know, obviously farming is part of that critical infrastructure. So there are things in place where we can keep things moving along. But you're right. We're right in the middle of this, and it's not going to let up next week or probably next month or who knows. So it's important to put these, you know, processes in place right now if people haven't already.
You know, I've got one more. I just had to think about this. So how's the turnaround time recently? Is it leveled, increasing, shortening, staying the same, or what could you?
Yeah, and when you say turnaround time, are you saying from when someone's tested to when they get their results? Yeah,
right,
I am not 100% sure. I know many areas were struggling, and some of our local and regional health departments moved lab vendors because of that. But I can't say if it's kind of leveling off, unfortunately. But I know when some of our health departments see an issue, they try to, you know, address it right away.
Yeah. Any more questions? So you can chat in here and ask questions if you'd like. Or any, you know, this one I'd like to ask for the audience. If any of you experienced different challenges than what we've talked about or tried to address here, or got a success story, or maybe not so good a story. Maybe I shouldn't do that. Is that not good, Corey?
Well, actually, it looks like we do have 2 questions. I'm not sure if
Okay.
these have been addressed. Maybe Katie, if you're able to address this, I'm not sure. Where do you see that infection happens most commonly inside the facility? Does this go back to it's not maybe, I mean, obviously surface is very important and something we need to be mindful of, but does it seem more like that respiratory droplet spread and just that person-to-person contact is the real concern?
Yeah, I would say that. I would say the concern is when you have, you know, people together in close quarters is where you're going to see most of the transmission. Yeah, there is, you know, the studies show that there is a possibility of getting it through, you know, touching surfaces, but the real issue we need to work on is you know, making sure that we're paying attention to, you know, being socially distant and wearing a face covering when possible.
Thank you. And we have another question as well. Renee, I don't know if you're still on. Renee did have to jump off to for another conflict, but Renee, if you're still on, or if anyone else on the call would like to speak to this, the question was, have you calculated the additional costs associated with the measures you are taking to prevent the spread of COVID-19? By what percentage do you think your costs have increased due to the measures you've taken?
Good question.
You may need to star 6 to unmute. Oh, it looks like we've lost Renee. Is there anyone else on the call that would be able to speak to that? Perhaps, you know, what greater expenditure that you've had associated with your operational expenses this year just to work on following guidelines and preventing the spread? Again, you may have to star 6 to unmute.
Well, you know, there's bound to be some. You know, they talked about that disinfectant service that they did. I bet that's not cheap.
This is true. And obviously, farming always presents its financial challenges, even in the best of times. So this is something that, for sure, our industry has seen a lot of difficulties associated with this, but I know that I'm personally heartened by the fact that the industry has really come together to find innovative ways to solve problems. And I think that's something that culture from the dawn of time.
Yeah. There was another question though, Corey, about, or Katie, is there a quick test available or a faster test available yet?
Yeah. You know, I have not seen any come through myself. I know this is something that we're starting to see other states get, I believe, and I think we may have had a couple, but I think what you're referring to are those point of care tests. So it's to to my understanding, it's not something we're seeing a lot of yet in Tennessee, and I am not sure when that will happen.
Okay. Well, I'm not seeing further questions. Katie, would you got any parting comments, and then we'll go to Corey, and then I can finish up.
Yeah, I think my main message is if you have any questions or concerns or anything about COVID in with your farm family, just please reach out to your local health department. They are there for a resource, and especially if you feel like you have even one person on your farm who you might suspect or have heard is positive for COVID. It's really important to engage the health department sooner than later, because they'll be able to help you figure out all of these things regarding isolating your cases and making sure your contacts are housed in one area and your cases are in another, and how the workflow is still going to happen. So please talk with your local health department sooner than later.
Okay, Corey?
And thank you. Just to echo what Katie said, and as I was mentioned earlier, we are all in this together. Obviously, this is, I think we've all come to accept the fact that COVID-19 is going to be something that's going to be around with us for a while. And as Renee mentioned, it's an ever-evolving situation. When we feel like we start to kind of get into the groove of it, something else comes along to kind of upend everything, and we have to pick a new path. So I really just applaud all of you and commend all of you for what you are doing to keep our citizens fed, clothed, and working toward the same goal of getting this knocked down and making sure that our supply is strong.
Yeah, and I'd echo the same thing. I mean, I'd implore on you to use these resources, work with your local health department, work with us, work with Tennessee Department of Health, and any way we can help, we'd be glad to. And we want to try to keep the supply chain, especially the food supply chain, as strong as we can. And it would be very disruptive if we had any farms have to suspend operations due to this. And so, these preventative measures, some of them are fairly simple. A lot of people have trouble executing them, but it's been proven in agriculture before, when we fought all number of diseases, how effective some of these simple processes, preventative measures can be. So keep the faith, keep working on it, and one of these days, it won't be COVID anymore, at least for a while, until the next pandemic, I guess. But I appreciate everybody being on, and I appreciate the partnerships that we've had with the Unified Command and the Governor's Office and the Tennessee Department of Health. And thanks to Corey and her team also, and everybody that worked on the translation project and all these outreach materials. It's been a lot. It's been a heavy lift, but I appreciate that. And you guys use these materials and these tools the best you can, and we'll get through this together. So anybody have any parting comments before we sign off? Okay then. Thanks everybody for being on.